Psychoeducation is part of it. Then, now this is the tough part. Often for having the most effective therapy and recovery from trauma, especially if people have had trauma memories lingering for quite some time, either lingering severely beyond at least a period of a couple of months, and sometimes it's years later, often you have to activate the trauma memory to diffuse it. The therapy techniques that we use often have an exposure element. And what that means, exposure to the feared memory. So we actually have therapy techniques which deliberately induce the memory and bring it to the surface. And that's really difficult because people feel just about as bad as when they're in their original situation. So we might get the person to relive a car accident or relive an experience of abuse, which, as you can imagine, is pretty tough to do because it brings up the feelings of helplessness and anxiety and fear and feeling unsafe. But we have different methods in a therapy situation to help the person feel a little bit more assured and feel a bit more safe, including spelling out what these methods are. And we often do them over a period of 2 or 3 weeks of more intensive therapy. And then after that, then the therapy involves helping the person reconnect with different things from the past, including, you mentioned, music that people relate to, or reconnect with routines or job roles, or restore friendships. And so there's actually 3 stages of therapy that we would describe for trauma. The 3 stages include establishing a sense of safety and trust. That's the person developing a sense of trust in the therapist, as well as trust in themselves to be able to go through the grueling experience of reliving past memories. Then there's remembrance and mourning. So the remembrance, like that exposure kind of technique, reliving a past experience, and then over 2 or 3 sessions often of around about an hour of reliving experience, often it takes the heat out of trauma memories. It helps defuse them. It helps the person take more distance from them. And it seems strange, but actually sometimes you actually have to activate the memory and make it hot again. You can't just sort of rationalize to yourself in your mind that it won't bother you. When people have, for example, post-traumatic stress, often they do have to relive the experience, activate the memory. And then with going through it, the exposure, the remembrance, there's also often mourning afterwards, acknowledging the losses that the person's gone through with their trauma reactions. Then reconnection, that can be the person reconnecting with themselves, reconnecting with other people, reconnecting with their joy of music, reconnecting with being able to visit places that they used to avoid because they reminded them of the trauma. And that reconnection helps people feel more whole again. So, the psychoeducation, strategies for managing with anxiety or arousal, because the therapy itself will bring up anxiety and distress. Then the remembrance and mourning, and the reconnection. There's some of the core elements of therapy for trauma reactions.